Hey, Chris, how are you today?
Hey Barry, I'm doing great.
That's great. Why don't you tell people a little bit about yourself?
I've been in the healthcare sector for the better part of about 30 years now. Um, learned a ton growing up in a household with a mom that was working in the healthcare space in an X-ray department, and my dad was uh, dealing with databases and mailing systems and things of that nature. So all kinds of opportunity to be inspired to use technology and to be engaged in supporting clinical care, certainly from a indirect perspective as opposed to hands-on. And I find myself 30 years later in a position where the work that we do with analytics, data visualization, all those things, not only can it, but it is actually having a very real impact on patient care. I couldn't have imagined it when I started out, but here we are. It's amazing.
Before we go into some of the discussions planning to talk about today, I wanted to ask you a little bit about Northwell Health and its response to COVID-19. Um,
Sure.
you folks have been on the TV not only locally but nationally, probably internationally, because of how you and your organization have responded back in March, April, and May. And I imagine that there are a lot of phone calls that you and your colleagues are getting from all around the country now as the pandemic is starting to spike in different areas. Um, can you tell me a little bit about that experience and a few of the stories about that and how you ramped it up and how you were able to respond and some of the things you did around analytics in that space?
Sure can. I think most of us probably had very similar reactions. We were, taken back because it hit so quickly. But one of the things that was dramatically impactful that we did in working with some of my team, we very quickly, as soon as we realized it was a probability we were going to see a spike in cases, we sat down to really map out um, the data model where we could begin to track patients that we thought were potential COVID cases. What was so different about it is we were learning on almost an hourly basis what are the characteristics, what are the symptoms, what are the presenting chief complaints, because there was no ICD-10 code when we started this to identify a COVID-19 patient. And so that was evolving, again, on an hourly basis. I think one of the other things that was rather interesting as well is we thought we knew what an ICU bed was, and it was simply defined. Turned out that evolved as well, because we were seeing such a rapid increase in admissions during as the things begin to ramp up and surge, where we were creating 200 additional beds on a daily basis. Simply unprecedented numbers we were seeing. We were having to convert other types of facilities, conference rooms within hospitals or even conference centers to put beds in there, transition some of them to become ICUs. So today it could be a conference room, tomorrow it could be an ICU. Unbelievably unprecedented times. I think the most remarkable thing that I saw in all of this was that our leadership team has done such an extraordinary job from a planning perspective to prepare the health system for uh, catastrophic types of events of all kinds of different varieties. The pandemic was specifically one of them. And we found this an unbelievably well-coordinated effort because of all the things that were planned for, one of which was the collaborative software that we were using. We started using video calling, we were using virtually everything at our disposal to coordinate activities. The level of commitment at every level of the organization was at its highest. We had folks in different analytic teams coming together. One of the daily huddles we were having, was one of our vice presidents from finance, our chief medical informatics officer, one of our data science leads. One of my clinical colleagues that works with me in my team directly. We had the head of our quality institute and a statistician from that group. And we were just looking at things on a daily basis, sometimes 2 or 3 times a day, having a touch point to make sure that we're paying attention and we can see what's happening so that we can help with load balancing and staffing and help our operations center to understand, when to anticipate a need for additional beds. We kind of eventually, well, I'd say eventually, it was pretty quick. Over the first few days, we arrived at a really critical measure, which was our excess admissions. In other words, the number of patients we're admitting versus the number we're discharging. And we were monitoring that number all the way through until we could start to project that we were going to start discharging more than we were admitting. I can't even begin to tell you how heartwarming that day was when we saw it for real. And then after seeing it sustained for three days, I think all of us started to feel like, okay, I think there's a light at the end of the tunnel.
I'm going to switch gears on you a little bit, and I want to ask you about dashboards and analytics. You and I had a discussion before we engaged each other today. How would you describe the perfect dashboard? I know nothing is perfect, but what would be the perfect dashboard that you would want to offer to your staff based upon their roles or whatever?
I think the simplest way that I think about it is it self-explanatory? When I look at it, do I see meaningful information that allows me to make a decision? Or do I need an explanation? And this can be achieved in a variety of ways. I think if you design it well, it's not complicated and it has the right context for the person that needs to be making the decisions. You can accomplish it with using hoverovers or things of that nature. If it seems appropriate, the use of trend lines can be helpful as well. But I think that the important thing is really the simplicity of it. Don't over design, don't over engineer. If a color means something, then it makes sense to have it there. If it doesn't mean anything, then we really need to be careful about that. The use of heat maps, for example, can mean a lot of different things. Is it that you have a denser population in an area if you're doing geospatial analysis, or is it an indication that something's going on that needs to be monitored? So red is something that I try to be aware of for that reason, because usually it means that you're just trying to alert you to something. But for me, simple is better. You don't have to be light on the data side to be simple, but you really need to make sure that it makes sense. Much like if you're telling a joke, if you deliver the punchline and you get a question in return, it probably wasn't an effective joke. Same thing is true with data visualizations.
So in producing a perfect dashboard, what about the person's role? And how hard is it to redesign these dashboards or create these dashboards for those different roles, making sure they all lead up to the same place and support each other as opposed to being counterproductive?
So I think if I'm hearing you, getting your question right, we're talking about making sure that we have consistency in how we source data, how we define data. But there's a different lens that you can put on it for different roles. Am I getting that essentially correct? So I think of it in a number of different contexts. So for example, one of the things that we did probably a couple years back is to support our corporate pharmacy. We built a data mart that contained pretty much everything that you would want to know around the pharmaceuticals that we were using in the health system, that we were distributing through the inpatient floors or prescribing in our ambulatory settings, anything that you would want to know about that. But it was done at a high enough level so that we can actually look at it from a prescribing trending perspective. But at the same time, when we started to really have our attention drawn to the opioid crisis, we could put a different lens on it very, very easily. But it's the same data source, so we're already confident that the data was curated and defined properly and can support that. We have other examples. We do some similar things for data quality. There's a number of ways that quality is measured, both from a regulatory standpoint and also from a contractual standpoint. We built a registry for our inpatient population, so whenever someone enters the health system, we start calculating all of these measures that tell us how we're doing with the quality of the care. And we have different perspectives that we want to look at that through. Some of it's down at a provider level, but some of it's also at a health system level or a hospital level or practice level. So there's a variety of ways that we can look at it, but the core data has been curated and managed and defined in such a way that it can support any one of those multiple visualizations that may be needed to understand or make decisions depending on the level and purview that you have inside of an organization.
So are you suggesting that organizations should think about creating a single source for data?
Whenever possible, yes. And why I say that is, particularly in the case of the current pandemic, it couldn't have been more real, the need to make sure that everyone was looking at the same definitions and the communication about those was consistent. It was very challenging. I won't sugarcoat that. We did have some bumps in there because the information that someone was basing some research on yesterday might have changed today. And so that communication, can really have a significant impact in the conclusions that are drawn from the type of research and the pace that they were needing to work at. So having a single source of truth, it is absolutely important. But I think the critical thing to understand about that is that it can be achieved with the right level of collaboration and the inputs of key people who have the best subject matter expertise in this space. One of the things that makes the work that we do effective is that I have a physician informaticist working on my team. He reports up to the CMIO, and he's really tied into the clinical leadership around the health system and virtually every specialty. He has a touch point where he can get the input and validate the decisions that we need to make around how things are going to be defined. And we try to stick to that, and we steer people to curated data marts as much as we possibly can to limit the risk for coming up with a different conclusion or a different definition because we're not being thoughtful about how we curate. That's absolutely a critical piece in my opinion.
Can you describe to me your definition of self-service analytics?
Absolutely. So kind of building on what I was just talking about in terms of building data marts, the reason that we do that is so we can allow self-service. As a physician, you know that if you're trying to do some analytics on a diabetic population, you don't necessarily want to have to go through the entire EMR back-end and query it. It can, but it's actually much easier if we can curate things in a way that really are logical. So surgery is a great example. We built a data mart specifically to support surgical analytics. It's not that it's not valuable to see other aspects, like the ambulatory activities, looking across the patient's medical history. Of course, there's validity to that, but it really is designed to make sure that we're targeting the disciplines that really have a heavy focus in specific areas to make it easier for them to do that.
We talked about this the other day when we were doing prep for this session, And do you think data quality and self-service analytics are competing values?
They can be if it's not done with a strategy in mind. Um, that's precisely what I've talked about. Building data marts, doing the curation, doing the lift to enable people to do self-service analytics. It's just really important. The quality aspect of it can be sacrificed if you don't have a strategy to manage the function. I won't say that we do it perfectly. We're still learning and we're adjusting as we learn. But the ability for finance team to be able to have accurate numbers is absolutely essential. And so our partnership with them is one of supporting them with the technology and the tools and making sure that they can get the validation that's required. So if you're doing something that's very transactional, then you have to tick and tie things. You just need to know out of the gate that your starting point is, we agree, is exact. And so from a clinical data set perspective, we look at everything in the data and analytics environments to make sure that it reflects what's in the clinical record. My friend and colleague is always saying that if it's wrong in the EMR, then it's going to be wrong in our data set. And if it's wrong in any one of our data sources, it's wrong in all of those places because it's coming from one source only. And so if you correct something at the source, it's corrected everywhere. And from a clinical perspective also, I think the critical distinction that we make is if it's good enough to drive clinical care, then that's what we should show in our analytics. Make sure that those things are always linked. But I have a team of folks that are really focused on the data quality from an ingestion standpoint, but also we have a clinical team that's really focused on not only making sure that we've got the right requirements, we're defining the right outputs.
So I've done a lot of thinking about the use of analytics, and the thing that has gotten me so excited about it in particular, analytics and dashboards and visualizations, is the whole idea that if you are able to deliver at the point of care in particular, obviously I'm a clinician, so I'm focused on clinical care more than operations, but it applies to both streams. I believe that if you can give the right dashboard with that self-service analytics, you can really inform the decision-making at that point of care. Or if you're in an operational environment, you can inform the decision-making at the point of making that decision. And the real value of analytics is its ability to inform people in ways to make better decisions based upon data that they're collecting anyway, oftentimes in transactional systems, to deliver better outcomes, whether they're financial, whether they're clinical. So the thing that I struggle with on how to do, I have some ideas on it, but obviously you're in the middle of it at Northwell Health, and you're leading teams that are trying to do this. How do you go about making analytics enterprise-wide, that everyone in an organization, from the CEO through the clinicians, through the operational people, even to the level of environmental services, are data-driven and using analytics to make their decisions, whether it's financial ones or whether it's simply how am I doing in cleaning this OR suite and how can I more efficiently do it and what should I keep track of? Do you have some thoughts along that on how you make this enterprise-wide?
I do. I think the critical piece of it is having the charge for doing just that. I really focus on enabling people in their different verticals. It's hugely important. You mentioned a few environmental services, for example. If the goal was to try to build a centralized function in the health system that can actually do all of those types of analytics, I think that's where things fall down, because there's folks that devote their entire professional lives in some of these verticals And it's unbelievably complicated, and their level of understanding and the proficiency with which they do what they do only comes because they've invested that kind of time. So, for example, I don't surface any finance information, whether it's our accounts or revenue cycle or cost accounting, that I don't have the the finance folks in looking at it and vetting it and validating it. It's unbelievably important, no matter what kind of discipline you're talking about. Our supply chain folks have a very specific set of things that they need to look at and measure to know that we're managing our supplies effectively. Um, Having visibility into our emergency services service line. It's a very different type of analytics that we do there from an operations perspective, because I really can't do much with retrospective. I have to have as close to real time as possible. And so we work very closely with our emergency services teams to enable them to define for us what those measures are. We support them in a different way. Um, and I think as I look through the health system, we have multiple teams. Our quality institute, they're exceptional in certain areas that they're charged with. And so my objective is not to try to do what they do, but to enable it to advance and be more effective. Similarly, in our ambulatory network, there's regional executives that have accountability for practices in their regions, and helping them by providing the different levels of information at a practice level is really important. For our physician network, we engage them in a way to provide analytics at the individual physician level. But in each case, we're looking at different data domains. We're looking at productivity. There's a group that's accountable to measure productivity. They are the go-to people. We work with them and partner with them to make sure that we're curating data that they can stand behind and endorse. The same thing holds true with our finance area, which I've already mentioned. We're having conversations now in the supply chain. Some things were highlighted in the midst of the pandemic that we need to tighten up and get better integrated data available on our supply chain for PPE, for example. So we're working with our procurement people and the folks who really manage logistics in that regard to develop some things that are effective there. But I think the same thing holds true over and over and over again. Environmental services is certainly one. Patient experience is another. All the survey data that I'm sure you've seen your fair share of it over your career as well. The patient satisfaction data that comes back. We've worked with our team that has a focus on the patient satisfaction and the overall customer experience to provide a data model that they can leverage to do their visualizations up front. I think there's different levels of expertise and capabilities in the different departments for a variety of reasons. But my charge and my team's charge is to find out what the level of need is and figure out how do we help them address that. And sometimes it's just as simple as providing some project management expertise to navigate the complexities of getting something set up or a data flow established within the health system, or it could be requirements documentation. It might be full-blown development of a data model and visualization. But the objective is always to try to find what's the level that we can engage that helps them to achieve their goals.
I sometimes think of the work done initially by Donna Bedian and then Deming and then even Berwick. And when I think of that environment, and now the analytics, and obviously when those people did most of their great work, we didn't have the tools that we have today. We didn't have EMRs, we didn't have analytics tools, we didn't have visualization tools or what have you. But I start to think of something like, how do you optimize the OR suite? And, we can focus on things that are pretty obvious. We can look at OR time by physician, and we can look at hospital and surgical infections, and we can look at how well the blocks of time that were allocated were utilized. But I also start to think of it, when I think of enterprise, I think, well, wouldn't it be great to give dashboards to environmental services people involved in cleaning that suite, give them surgical infection rates, so they can look at them and say, hey, maybe there's something we're using. Maybe we're using the wrong disinfectant. Maybe we're not cleaning this properly, what have you. So because they're part of that almost production line that I know Deming obviously talked about. It'd be so interesting to see when you put that basically from beginning to end and all the people involved in delivering the care to see how you can inform their decision making so that they can identify potential problems. And, oh, by the way, they're doing a job and they see that they're being successful and they're decreasing surgical infections, and environmental services is part of that, as well as the physician. Just see that analytics can be really a positive force in an organization by engaging people and building the teams and such. I want to ask you about the Analytics Resource Center, because you talked a little bit about that when we were prepping for this interview. And I know you're very, very excited about that. Why don't you tell people what that is and what it does and how it can be really helpful for an organization?
You're right. I do love this topic. For the longest time, as I've been in healthcare for, again, almost nearly 30 years, and in different organizations, I've seen a number of different approaches to doing analytics. But oftentimes there's a tension because there's multiple different areas in an organization that are doing analytics. There's always this idea when you start talking about a governance model, or if you start talking about a center of excellence, and a couple of different organizations, we've called it the Business Intelligence Competency Center, which I'm sure is familiar to folks. In different organizations, it has a different meaning for people, or there's some sort of stigma attached to it where people feel threatened, like you're putting in an enterprise data warehouse, you're going to take over the analytics, I'm not going to have a job. All those types of conversations tend to happen when you're starting to try to do enterprise analytics. And in thinking about it, in my last role before I came to Northwell, we tagged it as Business Intelligence Services, which was effective in a lot of ways. I think it lessened some of the tension that was there. But when I was thinking about it here, I don't know, I just couldn't arrive at the right way to describe the service until I was in a discussion with a friend of mine, and they were launching an analytic resource center, and then the light went on for me, like, you know what, this is what we need to call it, because it's not threatening. We're a resource. You can engage and benefit from what we do, or you could choose not to. But, if you go with the Field of Dreams model, if you build it well, people will want to use it. That's exactly how we thought about it. So I have a team of folks under a director for the Resource Center who are primarily focused on finding the right solutions for folks that inquire about analytics in the health system. And part of what they do is managing a website that has landing spots for just some of the different analytic teams in the health system, describes their leaders, describes their functions. In some cases, it gives you links to some of the specific outputs. We have some publicly, internal public viewable dashboards that are there that people can get. They can look at. They can see statistics on the health system if they want to. But the importance of providing this is to make sure that people start to understand there's a place to go to get your answers. And if we've got something that's already been defined and deployed somewhere in the health system, we want to make sure that people know about it and they have a way to find it. And before they go and start the process of building something brand new, it's a place where they can look to see if somebody's already addressed it. And if they have, we can connect people together. We can facilitate the conversations. Very frequently, a recent example is one of our teams at Lenox Hill has produced some really, really great visualizations to support operational areas in the hospitals. And because of the pandemic, we're taking a look at all of the different things that we're measuring at site levels, in addition to the Emergency Operations Center, and we're working to standardize that. And when we saw the quality of this visualization, we just said, listen, can we steal that? Can we use it? And people having the visibility comes through the establishment of this kind of a function where your relationship with different people in the health system is one of being supportive and as a resource to them. And so it just facilitates collaboration, and it makes it very, very easy to accomplish that. I see that our Analytic Resource Center growing to become, even a larger part of the value and the benefit of analytics in the health system, because it's facilitating that coordination, and it acknowledges the complexities that really require multiple disciplines doing analytics in their own space, but the need to bring it together and make sure that we're leveraging the capabilities that we have effectively and not duplicating efforts are opportunities to really get a great understanding of what's happening in the health system is really dependent on how well we coordinate, and meaning that if three of us are focused on the same thing unbeknownst to each other or even on purpose, there's other things that we're not paying attention to that we probably should be. And so I really lean on the Analytic Resource Center and its leadership to help make sure that coordination is happening. Again, we're learning and we're growing, but I see this being a very positive model and very non-threatening, which I think is one of the key things from a point of entry. If you want people to be comfortable, they need to feel like you're a resource. You're not trying to take on their role.
You know what I hear in your voice? That I hear the concept of service, servicing the clinicians, servicing the operational people. What I don't hear in your voice, which I think is good, I don't hear about control. And oftentimes people look at IT departments as control versus service. How did you get to service, and how did you get all the people who work with you and for you into that idea of analytics being service versus it being control?
That's a great question. I think the organizational structure that our CIO has set up, I think, is very service-oriented. And there was already a culture of that when I arrived here, which I'm extremely grateful for. And honestly, it was one of the things that I found attractive about the opportunity to come to Northwell. But they're responsible for their core values. But I had some really solid leaders when I arrived. And, there's three different leaders that I have a daily scrum with, just to talk about strategy, where are we, those types of things. And these are just exceptional people, and they're passionate about the mission. And, because our role is not direct patient care, it really is a support role to those who are doing patient care, or to the ones that are making decisions around how we're going to provide the care. And so, in all of the conversations we have, everything centers on what's the impact and the value to our patient. We think about that constantly, even when we're sitting and doing technical design. We're having to be keenly aware, and one of my colleagues, he leads the informatics teams in my group. He's always saying, listen, people aren't coming to Northwell because we've got great dashboards. So let's keep the right perspective. We're here to support clinical workflow. We're here to help provide insight into all of these different areas of health system operations, supporting our research teams to make sure they have what they need to get the insights that are necessary to support the innovation that's really been put at the forefront as an area of focus in the health system.
Sounds to me like you're a caregiver.
I appreciate that. It's quite humbling to hear that perspective from somebody that's doing clinical care. I feel unbelievably fortunate and blessed to be given opportunity to support people like you that took the Hippocratic Oath very, very seriously. And in the practice of medicine, I think it's lost on some people, but it's an evolving practice where you all are always trying to find a way to do things better, trying to get a better outcome, trying to find better ways to take care of the people that present in front of me. And, it's an honor and a privilege for me and people that I work with to bring an intensity to trying to innovate to make it easier, trying to make sure that you've got better information at your disposal when you're face to face with a patient. It used to be that you're reliant on your own medical practice, you're reliant on your medical journals and professional associations, and the ability to recall based on the symptoms that present to make a decision. Now we have the opportunity to put a lot more meaningful information in your hands at that moment in time, and that's what we're trying to do. And we challenge ourselves consistently to make sure that we're focused on that. Because it's not all data is relevant. We all know. I mean, I can put together a visualization that will make your head spin or look really, really pretty, but it may not have any meaning because it's not the right data. And so having the right data is a critical piece of it. And to me, that's the hardest work in the analytics space, is to make sure you've got folks that understand what the mission is and really, really focus on getting the right data.
Well, I have to tell you, medical knowledge is expanding so exponentially. We see that what's going on with the COVID-19 pandemic. There is no way any clinician can keep up. Any tools that you can give us to allow us to do our job better, to be better focused on our patients, to listen to them, particularly when they're uncomfortable, they're in pain, and they're scared. So we don't have to remember things that a computer can do well, but we can focus on those others, or you can focus our mind on the data points that are important and impart to us the best medical knowledge based upon the analytics. That's a great service to us. It's the idea of a team, and doctors treat patients, but nurses treat patients, and therapists treat patients, and the IT department and the financial staff and the ADT, the people who admit people and fill out the forms, they all, in a sense, treat patients also, because as a team is the only way a hospital or a clinic or a doctor's office can function, and we all have to support each other, particularly in this environment where there's so much information, things are changing so rapidly. The only way we can be successful is a team. On the team concept, you've talked a little bit about the need to build teams within an organization to achieve widespread enterprise analytics. Can you comment a little bit about that concept?
Yeah, I think it's enormously important and never more evident than it has been over these last few months. We've had folks that have been entirely focused on curating the data for the COVID population to get as much information and insight as we could, because we knew that not only our own health system was in a really difficult position, but the whole entire state and ultimately the world really have a great need to understand as much as possible and as soon as possible about the evolution of this disease, and is it going to get worse, or are we going to have resurgence? There's so many different aspects of it that we have to understand. So it takes a team of people to do that. And I mentioned earlier that the different disciplines that were brought together, where we were looking at data on a sometimes an hourly basis, to be able to anticipate the needs for staffing, for beds, coordinating the countless people that came in from other parts of the country to help us here in New York. Being able to manage those things effectively, it took a team of people that didn't typically work together on a daily basis to come together and bring their perspectives and really have the hard conversations to figure out what do we know and what don't we know, and what level of confidence can we provide in what we're seeing and anticipating that helps the decision makers to plan effectively, so that we're not constantly trying to catch up. There's other teams that were focused on so many different aspects of it. I'm working in a couple of different teams right now. One team has folks from multiple parts of the health system, finance, clinical areas, practice management. There's clinical team members, all focused on how do we optimize our ambulatory network. And all of those folks are necessary. And there's some different teams. I think there's at least 3 different teams represented in that particular working group that I'm working in, who all have unbelievably talented people doing some development work and doing some visualizations. And, our role, from my team's perspective there, is just providing some support, helping with data infrastructure, helping with expertise for building the models, whatever's needed there. Similarly, we're doing the same type of function within the hospital analytics area, trying to help the operations folks, both from a site perspective, but then also providing a system perspective, so that we can help to provide the high-level view that allows us to accomplish things like load balancing. But these are just a few examples, but we're trying to make sure that we're enabling all of these different areas to be effective, to improve and enhance their capabilities constantly, because there's always a need to adapt and to make adjustments to improve the way we do things. And obviously, just the financial impacts of an event like this, just that one thing is enough of a catalyst to think about transformation. And we certainly have been doing that. Our leadership, made the decision very, very quickly. We're going to identify a number of different work streams, and we're going to examine absolutely everything about how we provide care and how we function as a system. And we're going to learn from what's working well and what's not. We're going to make adjustments. And in the last several months, I've seen several different announcements come out, all based on data and experience that have caused decisions to be made to change organizational structure, change the way we operate in certain areas. Those things aren't possible if you're not getting multiple teams engaged and not trying to find ways to support them to advance in each of their areas of purview.
A famous economist once said that a crisis is a terrible thing to waste. And as horrible as it's been in the last several months in New York City with the morbidity and mortality associated with the pandemic, it sounds to me that you and Northwell Health have taken that crisis and taken steps to make huge strides to not waste that people suffering in their lives, to make Northwell Health a stronger and better institution to serve the patients in your area. Can you comment a little bit about that and how you feel about it?
I'm absolutely glad to do that. And honestly, Barry, I don't think I could be prouder to be part of an organization as I am to be part of this one. Starting at the top with Mr. Dowling, as our president and CEO, extraordinary vision, and his leadership is something to me that it's impacted lives far beyond what most people would even imagine. But one of the things that really was important to me when I realized that during the pandemic, he actually walked virtually every ward in all of our hospitals. I found that to be extraordinary, and really demonstrating his passion and his compassion for the team that is providing this clinical care. And he personally has been doing what he can do to make sure that the employees are doing well. They're feeling the support that they need to feel. They're getting the physical support that they need, whether it's PPE or other things. But part of the impact of this for me personally has been seeing the executive team at all levels really committed to finding what are the things we can do better that make us better able to support our communities. They need us like never before. As we found out, there's definitely sectors of the community that have been hit and impacted harder than others here. And they're really taking a hard look at what can we do to make things better. Are there services that we need to provide in certain areas that we haven't been providing? Are we organized in a way that allows us to respond locally to something versus thinking about it only at a system level? It's a daily look, honestly, is how it seems, at everything that we're doing. Even in my space, they're really looking hard at, do we have the right things in place to really take the data and analytic transformation to the levels that we need to get it to? How do we get the right information in your hands, in your fingertips at the point of care? And are we getting all of the insights that we need to be getting? Do we have the right technologies that allow us to employ machine learning, artificial intelligence, other techniques to accomplish what you referred to earlier around being able to process the explosive growing number of data points that are coming into our health system? Every piece of technology we get starts generating another footprint. Every time a patient logs onto a different website, that's generating data, some relevant, some not. But do we have the right things in place? Are we making the right investments? Are we organized in such a way where we're going to be able to keep up with that and make sure that we're getting the right information in the hands of our caregivers, where it can make a difference in the lives of the people we're here to serve?
So when the COVID-19 pandemic hit, our CEO, Mark Benioff, said to all of us, he said, do what you can to help the people you work with. And that meant all of our employees, but it also meant our customers too. I've been in the vendor space a really long time, and I've always been focused on the idea of what I can do to help people like you use technology to improve patient care and outcomes and access and such. So the opportunity to spend time with you today and hear your stories makes me feel good that the work that I'm putting in has some value. And I want to tell you how proud I am to have known you and Northwell Health for the wonderful things that you have done for your community. And as somebody who grew up in New York City and watched what you did, it was personally very moving to me. So thank you so much for your time today, and I look forward to chatting with you again sometime in the future soon. Best of luck. Hopefully we will be successful in preventing this wave from washing over the shores of New York, and also be able to help all of our colleagues around the country and frankly around the world to get through this pandemic. I'm confident that we will do so, and we will emerge from it very strong. Thanks again, Chris, and have a great day.
Thank you, Barry. Thank you for the support that you and your team have provided throughout this and our entire relationship. As I've worked with your teams for a number of years now, and you guys have been exceptional partners, and I can't thank you enough for all of your support. It certainly made the work that we had to do in the last several months so much easier than it would have been otherwise. So thanks for that, and thanks for having me on today. It was an honor and a pleasure to speak with you.
Thank you so much. Bye-bye.
Bye-bye.
We'll now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard. We'll try to get through as many questions as we have time for. But let's start with this first question. And personally, I want to welcome everyone to our session. And thank you, Chris, for taking the time with us today also. So first question I want to ask you, how do you get stakeholders to trust the data and then the dashboards?
Great question. I don't think there's any single answer, but I think that the way that I've approached it, and I have colleagues around the country that doing the same types of things. We really try to make sure that we're engaging the stakeholders and the subject matter expertise right out of the gate when we start doing work on ingesting data. It's really critical to have the subject matter experts engaged when you're sourcing the data to make sure that you're getting all the attributes around the specific data elements, but even more importantly, if you're doing any transformation to the data, calculations, et cetera, you want to have the experts being part of it right up front so that they have a vested interest in making sure that it's done properly. The risk when you don't do that is really twofold. One is you always want to make sure that people that have purview over a particular data domain understand that you recognize that that's their purview, and it's important to you to make sure that you understand what they need and that your definitions are provided by them so that when you do deliver some outputs, it's trusted. I've seen it go the other way, where if you haven't engaged them up front and you deliver something, then they may not even be interested in looking at it. But if they do look at it and they find something wrong, you're not going to have the support that you need to continue to do the analytics.
So what about a report writing team? I think that's really what the Analytics Resource Center does, but how does that work? Is it a collaboration between your team and that stakeholder? How do people interact? How do you get the things done? I would imagine your resource center is significantly different than what we typically would think of as a reporting team.
Yeah, so there's a couple of different ways that the resource center operates. So in one aspect of it, we're actually enabling the self-service, as we've talked a little bit about. But we also do have a set of folks that do enterprise development for visualizations that really need to be productionalized and scaled for a large number of consumers. But we also have standard reports that we deliver as well. The intake process is standardized, so we have it set so they can create a request for us on our website. And depending on the nature of it, and we capture enough information on the form to route it appropriately. If it's clinical, we're looking to understand, is this inpatient focused or ambulatory, because we have two different oversight groups that made up of primarily CMIOs across the different hospitals in the health system, and then in some cases it's site CIOs that are part of the process. But they meet on a biweekly basis, and we bring to them what the requests are that we've received for them to review and help us to refine them, and then they set the priorities for us so that we know which things are the most important, and that drives the sequence of the things that we develop. Generally, those are the types of things we get. There's also some research stuff, and there's a research group that we support, but they drive in the prioritization of the research priorities as well.
As a clinician, I'm very much interested in how clinicians use dashboards and analytics. So how do you get clinicians interested in using analytics and sending requests to the resource center to create some dashboards that impacts clinical care? How do you get those doctors engaged? They're so busy, they're distracted. What brings them in?
Generally speaking, I think the work evangelizes for itself, and it's not usually us that are doing the evangelizing. When somebody has a really good idea and we produce a really good visualization that helps them, they start showing their friends, and then everybody wants it. So, I've got whatever you've got that looks really cool, Barry. I need that too. That's kind of what we see. Generally speaking, that's what triggers it.
Is there a secret sauce engaging people with analytics and dashboards?
I don't know if there's a secret sauce, but I think there's a couple of really, significant keys. And that's one is, I had a conversation with somebody earlier about this today. The way to get adoption is not to build something that you think is cool and then try to convince people that they need it. You want to be listening for what are the challenges people are trying to solve and try to focus your attention there. And if you do those things, then what you're delivering is meaningful. Oftentimes, and I'm sure you've seen this as well, people come in with solutions without understanding what the problems are that we're trying to solve. And, I don't want to see your cool, flashy thing. I want you to listen to what I'm struggling with and design something that helps me to fix that. So it's, trying to keep things in their proper order and perspective.
So you mentioned teams during your presentation. Where does the consumer of the dashboard fit into the concept of teams? Number one. And number two, related to that, how much iteration do you have to do to get the dashboard to be at the place where the consumer, the end user, says, aha, you got it, that's it?
I think it varies by the consumer, honestly. I've worked with some folks who really are they're sharpest when they're reacting to something that doesn't give them what they're looking for. So it really depends. And we have some other consumers that are so thoughtful and tuned into the analytics, they can pretty much draw out for us the visualization that's going to actually be valuable to them and get them the result they're looking for. But it's really kind of a soft skill, kind of a business analyst type of a role. The skill set resides in people at multiple different types of roles, but it's the same one. Just being able to understand gauge the level of engagement that someone, you're the consumer that you're trying to work with, really is going to be able to respond to. What's going to trigger their creative juices so that they can really help you to refine exactly what it is that they're looking for. Different personality types, different management styles, those things all come into play, I think, in that space. But from a team perspective, one of the things that's hugely valuable is when you do have one of those engagements where someone doesn't necessarily have a lot of time, and you're having a hard time to get what you're looking for. And oftentimes the key is just get them to spell out the problem, take as many good notes as you can, and then bring it back to the homestead where you've got your colleagues, and talk to them and work through it a different way and pull on the different levels of expertise and perspectives that people bring to try to round out the picture so that you can start at least putting together a proof of concept.
We have like 30 seconds left, but I wanted to ask you before I let you go, what are your plans relevant to the fall with flu and COVID? Can you give just one or two sentences of advice to people out there on what they need to be thinking about or using analytics to address the potential of a flu and COVID spike in the fall?
I think the critical things that we're doing are probably things that everyone else is trying to think about, is just paying very, very close attention to how things are working and what's happening with the social distancing in the area that you're in, and just keep an eye on what you're seeing from a testing perspective. How prevalent is testing? Is it happening regularly? And what are those numbers doing? Are they moving up and down? Or are they relatively stable? We're looking at a rolling 7 days, or in some instances, and in some looking at a rolling 3 days, just to see is there really a movement in the number of positive cases being reported, so that we can anticipate a potential spike, hopefully before it's too late for us to be prepared and we get overrun.
You're doing all of that with dashboards and analytics. Chris, thank you so much for your time today. I'm going to turn it over to Ayla, who's going to close out our webinar today.
Thank you.
Yeah, that is all the time. Thank you so much, Chris. And that is all the time that we have for today. I want to once again thank Dr. Chaikin and Chris for their excellent presentation, and Tableau for sponsoring today's webinar. Please enjoy the rest of your day, and we look forward to having you join us for future webinars.